Hi, everybody. Thanks for joining me today as I make an announcement that I am running for president of the National Council on Interpreting in Healthcare. I'm not just running as an advocate for language access, I'm here as someone who has lived through the same challenges faced by our limited English proficiency community in healthcare. As an immigrant, I watched my grandparents struggle to find their way within a healthcare system that failed to offer proper language support. And it was this experience that ignited my commitment to bring about positive change. As the child interpreter for my family, I did have to learn how to navigate the US healthcare system, and I learned about the importance of sharing cultural differences before assumptions had time to harden. I firmly believe that education is the key to unlocking language access for all, but not just for limited English proficient individuals, but for everybody who participates in the system: the interpreters, the providers, the administrators, the IT professionals, and in particular, and most importantly, our legislators. This belief has been driving me and my work for over a decade with National Council's Home for Trainers work group, my own consultancy practice, and my teaching. My professional journey includes roles as a trainer for Rhode Island Hospital's Primary Care Resident Fellows Program. I was a Portuguese and Spanish staff interpreter at a trauma center, Portuguese and Spanish translation supervisor at a law firm, Portuguese and ESL language teacher for the Red Cross and other locations across the country, and an adult literacy tutor. I supervised interpreters at a level one trauma center where I provided monthly continuing education training to interpreter staff and to all newly hired employees that would be involved in direct patient care. I've been a national director of interpreter quality for a language service provider and a director of multicultural programs and services for a private company. Currently, I consult with local governments, police departments, healthcare systems, and Washington State's Department of Social and Health Services. During my 6 years as a commissioner with CCHI, my primary responsibility was overseeing continuing education for interpreters, and I've dedicated my career to ensuring competency and proficiency of language access professionals and the creation of an accredited national interpreter certification. So, together, we have achieved significant milestones. NCIHC's Home for Trainers offers all of our members free access to over 60 archived webinars and continuing education opportunities, actively supporting and contributing to initiatives that led to the creation of a national certification for healthcare interpreters has consistently been my focus, and national certification for healthcare interpreters became a reality in 2011. However, our journey does not conclude here. We are now at a critical juncture where unity is essential for expanding language access services in healthcare, especially amid our changing political climate. It's time to broaden our membership and reach out to include allied healthcare and educational professionals. Let's extend our services beyond continuing education and other member benefits to include greater outreach and fostering closer connections with our sister organizations. The time is now to join forces and make a lasting impact. The very first step is participation through voting, but the most crucial step is active involvement. Consider volunteering with one of our many work groups, joining a committee, or better yet, bring a friend or two along. Share your vision with us for the future, and let's collaboratively work towards making it a reality. Yes, we can do this. Thank you, everyone, for your consistent support. To all of you currently volunteering on a committee or a work group, thank you for all of your hard work. I look forward to tomorrow and eagerly anticipate the journey ahead as we collectively strive to bring positive change to language access in healthcare. Regardless of the outcome, win, lose, or draw, I'm still going to be here. I'm still going to be working with Home for Trainers. I'm still going to be recording podcasts for Standards and Training Committee. I'll still be supporting national standards of practice and helping languages of limited diffusion vet resources that are reliable and free and available to our members. So come, let's work together. Like I said, we can do this, and the time is now.